Panretin Gel, also known as alitretinoin, is used to treat skin sores in patients with a certain type of AIDS-related cancer called Kaposi sarcoma. It belongs to a class of medications called retinoids, and it works by affecting the growth of skin cells. It's important to note that this medication should not be used when medications taken by mouth are needed to treat Kaposi sarcoma, such as if you have had more than 10 new skin sores in the previous month, or if the disease affects the lungs or other organs. When using Panretin Gel, it's important to only apply it to the affected skin sores. Make sure to wait at least 20 minutes after bathing or showering before applying the medication. Apply enough medication to cover the sores as directed by your doctor, usually 2 to 4 times daily. You don't need to rub the medication into the sore, just allow 3 to 5 minutes for it to dry before covering with clothing. Avoid applying the medication to unaffected skin or in sensitive areas like the eyes, nose, mouth, anus, vagina, or tip of the penis. If the medication does come into contact with these areas, make sure to flush with plenty of water. After using the medication, remember to wash your hands unless you are using it to treat the hands. Avoid bathing, showering, or swimming for at least 3 hours after applying the medication. And don't wrap, cover, or bandage the affected area unless your doctor tells you to do so. Use the medication regularly at the same times each day to get the most benefit from it. You should also avoid applying other skin products on the treated sores, except mineral oil, which can be applied at least 2 hours before or after using Panretin Gel to help prevent skin dryness and itching. If you are pregnant or may become pregnant, it's important to avoid handling this medication as it can be harmful to an unborn baby. Let your doctor know if your skin condition does not improve or if it worsens. You may start to see an improvement in as little as 2 weeks of treatment, but it may take up to 14 weeks to see the full benefit. Some common side effects of Panretin Gel may include redness, rash, pain, burning, itching, stinging, or tingling at the application site. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as blistering, crusting, oozing, or peeling of the skin, severe burning or stinging of the skin, or swelling of the skin. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist for guidance. Before using Panretin Gel, it's important to inform your doctor or pharmacist if you are allergic to it or any vitamin A-related drugs, as this product may contain inactive ingredients that can cause allergic reactions or other problems. It's also important to tell your doctor about your medical history, especially if you have a certain type of cancer called skin T-cell lymphoma. It's important to note that this medication may make you more sensitive to the sun, so it's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, be sure to inform your doctor. If you are pregnant or plan to become pregnant, it's important to discuss this with your doctor as Panretin Gel may harm an unborn baby. It's also important to note that since this drug is absorbed through the skin, women who are pregnant or may become pregnant should not handle this medication. Additionally, it's unknown if this drug passes into breast milk, so breastfeeding is not recommended while using this drug. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications, as they can affect how well Panretin Gel works and may increase your risk of experiencing serious side effects. Make sure to keep a list of all the medications and products you use, including prescription and over-the-counter drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Additionally, be cautious with products containing DEET, such as some insect repellents, as they may interact with Panretin Gel. Always consult with your healthcare provider before using any new products or medications alongside Panretin Gel. If accidentally swallowed, Panretin gel can be harmful and may result in serious symptoms such as passing out or trouble breathing. In case of an overdose or ingestion, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. U.S. residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. This medication is for external use only. Do not take it by mouth. Apply a thin layer of Panretin gel to the affected area once a day, preferably at bedtime. Use this medication regularly to get the most benefit from it. If you forget to use Panretin gel at your scheduled time, use it as soon as you remember. However, if it's almost time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not apply double the amount to make up for the missed dose. Make sure to store Panretin gel at room temperature and keep it away from heat and open flame, as it is flammable. Keep it out of the reach of children and pets. If you no longer need the product or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to dispose of it. Remember not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.